Jim, I don't know, many of youngsters know, it is a gastroenterology medical center, a dedicated gastroenterology practice. The subject which we know want to serve the community. That's why 2000 we established Gem Hospital, Coimbatore first time. Then subsequently, of course, we have a chain of hospital at Chennai. You have seen that the last 2 days, even day before also, we had a training course there. Everybody appreciated training course. They can do hands-on program in this. They are very happy coming and tell me, sir, we learn, very happy about it. So this is a dedicated center. When we started at that time, people also said, single subject you are starting, don't want to take risks. Why not you go? No, we are not a business people. We are a science promoter, gastroenterology science. So nothing, need not worry about money and what we know we'll teach. What we know we serve the community. What we can innovate, we'll innovate, and ultimately be part of the society. So we love the people, be part of the people. That way, Gem Hospital stand with this. And equally, when we started that time, not much center, only Nageswari did Hyderabad and a few of them here and there. Now because of Nagesh Reddy, because of teachers, many of the people today across India, even at Taluk level, people are practicing so high quality minimal invasive. But today, the discussion going on, the concept, one side, the talking surgeon means open surgeon. That is all gone. Oh, no, if we talk about anything surgery, it should has to be minimally invasive surgery. Again, if we talk about interventional, it has to be focused. So here, marriage like happening between the interventional radiologist, physician, and surgeon coming together, it became a new specialty now. That is where we can do much more. That's what last 2 days you all listened to it. So today, unfortunately, I could not talk interface between emerging it. So today, hereafter, no surgery means minimally invasive surgery, and minimally invasive therapy is a correct word to use. Physician and surgeon can come together to work for, and we can have a consensus what to do the best. Ultimately, the patient is worshipping. That's why I always take a folded hand in front of every patient before you deciding a treatment protocol, because so many things will happen. But patient should receive the best care of patient. That way, this conference I'm from my heart, I'm saying very successful because of the faculty, because of the delegate participation, interaction so well. And so I'm very happy about it. Indian surgeons finding lot of difficult and doctors finding difficult because of strategy. You look at system in India is something not like Western countries. Follow private colleges, medical government, like an institution like AIMS, lot of things. In spite of this, every doctor, physician, surgeon, irrespective, they try to do the best for the community. And lot of innovation have come from India as well in bar with Western countries. That way, I started and jump and minimal invasive onco surgery is today we have to promote well. And still in India, it is not happening like Western countries. If you go to Korea, if you go to Japan, Taiwan, highest percentage of cancer today taken by the minimal invasive, maybe laparoscopy, robotic. Japanese government pays 50 to 100% remuneration more insurance because patient gets the benefit. So that means we have to push little more in complex surgeries and particularly the minimal invasive way. All of us jointly work it. And this is the first SCOPE program. And I congratulate my own team, Dr. Vinod and the entire team taking a last few months and great effort have taken inviting all. And in spite of short notice, our international faculties come all the way from different countries, states, and Japan, everything. I'm thankful to all of you, appreciate your gesture towards us. And this scope is truly a good scope for India. And we definitely, in this part of the country, will work it continuously to do the best care. And this take opportunity to thank every one of you with a folded hand. Any shortcomings, and always it is happens part of it, not why intentionally we try to do. Our hospitality people organize, everybody wanted to do help and be part of informal and be with us. Thank you very much. Welcome all of you to this.
But I just wanted to say a few things about research, about innovation, and also some lessons that I learned, during COVID when I was the chief scientist at the World Health Organization. So from a young age, I was always interested in research. Maybe that was the environment in which I grew up, but I wanted to be a neuroscientist or a genetic, actually a scientist going into human genetics. But as it turned out, I then ended up going to medical school. That was not my first preference. But even after going through medical school, I continued to remain absolutely committed to a research career. And I must say that when I came out of medical school, or even during my years there, no one talked about research, about medical or health research. None of my faculty members, teachers, professors, in fact, they were all extremely disappointed and said that, I should have had a brilliant career in clinical medicine. And why did I want to go into pure research? It was when I went to the US to do a fellowship after my MD that I really got inspired by some of the mentors at the University of Southern California in Los Angeles at the Children's Hospital, where I learned what research methods is all about, how to ask the right questions, how to design and it was all clinical research, mind you. It was not basic lab research. I was also very clear. I didn't want to be in a lab and I did not want to be in an animal facility experimenting on animals. I wanted to do clinical research on clinical problems, day to day clinical problems. And so I did my fellowship in pediatric pulmonology. And then when I came back to India, again, I was very committed to working in India. So I spent 3 years abroad and came back. And again, everyone I met told me that I should get into clinical medicine. But of course, at that time, the subspecialties were hardly known. So pediatric pulmonology was not really anything anyone was aware of. But still, we had a huge burden of asthma, of many other lung diseases in children. And the other thing was I could not find a job where I could do some clinical practice, research, and teaching. So things have changed, of course, since then. And what I see today is that there's a lot more research happening. In fact, outside the government system as well as within the government system. And some of the best research that's come out of India in health, I think, has been in private settings or in NGO settings, in rural areas, tribal areas. So I think that the lesson is you don't need high tech, you don't need big huge labs or facilities to do high quality research. You need good powers of observation. You need a deep interest in improving the situation that you see. And that's what we heard, I think, from our innovators today, that when they found a problem, they wanted to tackle it, they wanted to make things better for the patient. So I think research is all about making things better and improving on what you found it earlier. And so this is why everybody must and can do some research wherever you are.
Or medical gastroenterologist maneuvers inside the cave of the alimentary canal. The great adventurist, the various adventures you undertake for the every journey you take for each and every patient is surmountable. Sometimes the cave is bloody, the clave is aggressive, catching a feeding artery, identifying the culprit lesion, taking a tissue biopsy. Thanks, my friends. You've been really good help for our practicing physicians to make a diagnosis. Welcome to Chennai to the external world delegates. You are in the right place because Chennai is the cusp area of both East and West practices, of the best medical practices of the entire world summating at one point. I congratulate the Society of Gastroenterologists and GEM Hospital to organize such a big conference for summation of various ideas between the East and the West at one point, that too in Chennai. We come from a unique state when compared to the rest of the country because our health system has been the best model to emulate for any developing nations. Many international epidemiological reports and anthropological reports or medical human resources are favored Tamil Nadu model of health delivery system. Here we have a excellent proposition given to the world, especially in developing nations, where generations of education has been limited only to elites. So Tamil Nadu is the foremost state who broke the elitism in medical fraternity. And I stand here as a proud person belonging to this health system, where we reached a concept of reaching healthcare to the commoner. What's the solution is to make the commoner as medical doctors. We have the special affirmative action in our public health system, public health education, so that we have representations from all type of spectra, first generation doctors, socio-economic backgrounds, as endoscopists, medical gastroenterologists. Attending an international conference of this kind is unique proposition when compared to the rest of the country.